going to look at the types of the respiratory failure. So we start off with some questions. The first one is the hypoxemia with the capnia. So in this condition, what is the mechanism? The second one is really pertaining to shock. What is the mechanism of this shock? So in this video, we'll find these answers and learn in detail. So to begin with, firstly, we are looking at the acute hypoxemic respiratory failure. So under the acute hypoxemic respiratory failure, what is the mechanism? So mechanism is that the alveolar flooding and the subsequent intrapulmonary shunt physiology, and there is also the low O2, there is a normal or low PCO2, and there is high PaO2. And just recap, we have the acute hypoxemic respiratory failure. So under acute hypoxemic respiratory failure, the mechanism is that there is a alveolar flooding and there is subsequent intrapulmonary shunt physiology. There is a low O2, there is a normal or decreased PCO2 and a high PaO2. Now we are looking at the associated conditions. So what are the associated conditions? So under the associated conditions, it includes sepsis, then the gastric aspiration, then comes the pneumonia, then is the near drowning, the multiple blood transfusions, as well as the pancreatitis. So then we'll be looking at the associated conditions. To recap, we saw sepsis, gastric aspiration, pneumonia, then the near drowning, the multiple blood transfusion, and the pancreatitis. Next, we are going to deal with the hypoxemia with capnia. Hypoxemia, this is with the hypercapnia. So hypoxemia with hypercapnia. So what is the mechanism of this? Mechanism is simple, that is, it results from the inability. So results from inability to eliminate the carbon dioxide effectively, and there is presence of the low PO2. There is a low PO2 and there is a high PCO2. There is a low PO2 and the high PCO2. There is also a normal. There is a normal PaO2. So let's recap. So we dealt with the mechanism of the hypoxemia with the hypercapnia. So here it results from the inability to eliminate the CO2 effectively. So there is a low PO2 as well as the increase in the PCO2. So what is normal? The normal in PaO2. Now we are going to look at the associated conditions. So associated conditions, it includes, there is a drug overdose as well as there is brainstem injury. Drug overdose, brainstem injury. Then comes the sleep sleep disordered breathing. Next is a severe hypothyroidism. Then comes the MG, myasthenia gravis. Then the Guillain-Barré syndrome and the amyotrophic lateral sclerosis, ALS, amyotrophic lateral sclerosis. So let's recap. We saw about the hypoxemic with the hypercapnia, so the associated conditions, and nothing but the drug overdose. There's a brainstem injury, there's a sleep disordered breathing, there's a severe hypothyroidism, myasthenia gravis, Guillain-Barré syndrome, amyotrophic lateral sclerosis. Then we are looking at the perioperative respiratory failure. So the perioperative respiratory failure. So under this, what is the mechanism? Mechanism is that it results from the lung atelectasis. And what are the associated conditions? The associated conditions, if you see, it is nothing but it is present after the general anesthesia. Next, we are going to look at shock. So under shock, the mechanism is that it results from the hypoperfusion of the respiratory muscles. The hypoperfusion of the respiratory muscles in patients with shock. And the associated condition is nothing but the cardiogenic shock. Now let's recap. So we dealt with the perioperative respiratory failure. So the mechanism is lung atelectasis. The associated condition here is nothing but after the general anesthesia. So the shock, if you see, it is the hypoperfusion of the respiratory muscles in patients with shock. The associated conditions, that is a cardiogenic shock. Now we will be answering our question. So the first question we asked was, in terms of the hypoxemic with the hypercapnia, what is the mechanism? So here the answer is, it results from inability. It results from the inability to eliminate the carbon dioxide effectively. And there is a low O2 as well as high PCO2 and normal PaO2. So let's recap. So we asked about the hypoxemic with the hypercapnia mechanism. So it results from the inability to eliminate the carbon dioxide effectively, and there is a decrease in the low PCO2 as well as the high PCO2 and a normal PaO2. The next question we asked was, what is the mechanism in case of shock? So in terms of shock, the mechanism is that it results from the hypoperfusion. So it results from hypoperfusion, and this is of the respiratory muscles, and this is in patients with shock. So the mechanism is that it results from the hypoperfusion of the respiratory muscles in patients with shock. So this was about the types of the respiratory failure. To learn and grow daily, please do subscribe.